Howdy. I'm Peter Van Loon, and I come from Connecticut, ran the operations, IT, people, process, HR, marketing, sales, plan management for the exchange in Connecticut. Just finished our second open enrollment. It's been stultifyingly boring and routine. And we're glad about that. And the fact that right now we are looking at, what's the right word? Right-sizing our staff from a build to a run. Customers are getting smarter. We're getting our processes and technologies maturing. And we're looking forward to running our exchange more efficiently than we have the last 2 years. One of the things that we've can't do or must do together is to collaborate and to reuse a lot of things that we do. I always got a kick out of it when we. How many people from CMS are here? Okay, well, I'm in trouble with them anyway, so what does it matter? Through the process of blueprints, through the process of reviews, through the process of FDDRs, through the process of operational readiness reviews, always came down to what are you doing to reuse? And we basically came up with stuff. We put down answers. I can't remember what they were, but we really didn't. And the fact was, as I talked to other states, but I won't ping them on them. You can just hassle Connecticut. Is we were all too busy. We were looking at the 1st of October 2013, and the idea of stopping what we were doing to go work with somebody else about how we may be able to collaborate or reuse technology or process or people, it just wasn't in the cards. So as far as the CMS requirements to use for reuse, I went back to a concept that I did when I was in the military, and that was the concept of creative disobedience. Saying, yes, we're reusing, but in reality we did not. But that was then, and this is now. We've had, as some of us have done okay, some of us have done poorly. I look back and I see all the things that we screwed up, what we did to correct them, and I wish I had had some folks to tell me how to do things a little bit better. We'll be in a position, I think all of us, to be able to tell other people that might start state-based exchanges, state-based marketplaces in the future as to what they should do to collaborate and to reuse. We've got a great panel here. What I'd like to do is we're going to have some, just go through, have people introduce themselves. We've got, going here from my left over, Ethan Owen, who's the CIO of Idaho. They just started up their own exchange, moved from the FFM. We've got Prabhi, and I get your last name, Prabhi Ram, Prabhakar Ram from hCentive. They've kind of seen things a lot of different places, feds and states. Subi, and help me with your last name? Muniasam. He and I are colleagues from Maryland, working in Maryland and Connecticut. We've had an interesting partnership that we're going to continue. CIO there. And then Jason Hetherington from Massachusetts, which is glad to have him here. He's kind of representing Massachusetts because they're the ones that started this. Now, I happen to know that there's a guy that used to work at Massachusetts by the name of Kevin Coonahan. Massachusetts was wise to kind of dispense with his services at some point in time. we in Connecticut were wise too and dispensed with it also. But so I guess we have done a reuse. We've reused management, and that's an example I hadn't thought about. But I'm certain we can do more. So why don't we start with Ethan, introductions, and across the board, and then we'll go with some questions. Okay?
Hi, I'm Ethan Owen, CIO for Your Health Idaho.
Well, no, that doesn't work, Ethan. You've got to spend some time saying, all right, what's going on in Idaho? Where does Idaho fit? Because it's interesting where you guys are. I think you're novel across the whole country.
Interesting choice of words, yes.
Well, aren't we all?
So Idaho, for its first year, was on the FFM. So we didn't have enough time to figure out how to create our own state-based marketplace. So for the first year, we had outreach and education, some other key functions in-house, while we utilized the FFM's architecture and solution. We then went down a path of creating our own state-based marketplace. We were initially going to do that with Get Insured, where we were going to handle all of the APTC determinations in the cloud. Our partners at CMS had just built a system with DHW, so asked us to kindly partner with them. So we have a mixture of vendors there. DHW, our human services, handles all of the APTC determinations, passes things over in account transfer. All the shopping then takes place on the HIX solution from Get Insured. And then we transfer over to the carriers for the payment. So it's a highly distributed model in that respect. So it was a very interesting first year. We also decided to couple it with a conversion of data. So we had a passive renewal, which was a mix of FFM data, carrier data, for roughly 85,000 people. So it was extremely exciting, challenging first open enrollment.
85,000 QHP?
From last year, correct.
Okay, and how many Medicaid folks in addition?
I don't have those numbers off the top of my head. Apologies.
No? Okay. Thanks, Ethan. Sure. The Prabhi?
Yeah, good afternoon. My name is Prabhi Ram. I head the product strategy and product management function for hCentive. Let me just give a brief overview of hCentive. hCentive is based out of Reston, Virginia. Back in 2011, 2012, we started to build our public exchange marketplace platform branded as WebInsure. In 2013, we went live both in individual and shop in about 3 states, Colorado, Kentucky, and New York. In 2014, we worked with Jason and Massachusetts. We went live on individual marketplace. And also we launched our platform is the one with runs the healthcare.gov's shop marketplace running the shop in 33 states. This year in 2015, we got awarded the contract for Arkansas shop, and we just got started with the project. So I guess from my standpoint, I'm an odd person here as a vendor in terms of just want to share with you where we have evolved the product is, we started off with primarily focusing on shopping, consumer experience. I would call that as a sort of a phase one, trying to get the system up and running, both for individual and small business. Where we have evolved the product is we have built the product now to have all the 360-degree functions of what I would call as a HIX operating system, starting from plan management to marketplace function to financial management to customer service.
Okay.
And this is the thesis where we are evolving the product.
Okay, Prabhi, thank you. I'm going to cut you off because we're down short time, and I want to make certain we get everybody introduced and we get some questions going on. Sue, go.
Good afternoon, everyone. I am Subbi Muniasamy, CEO for Maryland State Exchange. I have been in this position for the past 10 weeks. And when talking about the reusability, I can tell with the pride that we use the entire system reused. Fundamentally, we transfer the entire Connecticut solution from Connecticut to Maryland. We have a very good working relationship with the Connecticut state government, and we really reuse the entire system, not piecemeals. The entire system has been reused. On top of that, we did some customization to meet the Maryland need. So overall, at this point, the system is functioning well, and 325,000 enrollment has been done through this exchange. Among that, before Peter is asking me a question, I can answer like 85,000 people APTC, and 35,000 QHP, and 200,000 people Medicaid. So that's a quick introduction of my side.
Sure. Hi, everyone. I'm Jason Hetherington. I'm the CIO from the Health Connector in Massachusetts. I'm going to take us back just a little bit and do a little bit of Massachusetts history, if I can. When we started our ACA implementation in 2012, 2013, Massachusetts had grand plans for sharing. We were an early innovator state. We actually had in our systems integrator contract specific line items for project managers for each of the New England states to do collaboration and sharing across New England under a construct that we called NESIS, the New England States Collaborative for Insurance Exchange Systems. But as many of you probably know, our first implementation was quite troubled. One of the first things that we stripped out of that systems integrator contract and that we sort of abandoned as we moved toward the opening of the first open enrollment was the collaboration amongst states. Our staff just didn't have time. The implementation was challenged. We weren't hitting our internal milestones. And so sharing was one of the first things that went away, I think, to the detriment of some of the states we were working with, particularly Rhode Island, who had gone through the first several gate reviews with us. Ultimately, that system that we stood up wasn't successful and had to be replaced. This year, we have stood up the hCentive system. It's fully integrated with our Medicaid, so it does MAGI determination across the full spectrum. And really only, I think, at this point is Massachusetts back to the place where we're able to share and we're ready to share with other states. The marketplace as a whole for our first year was just, in my opinion, not mature enough to support collaboration and sharing across states. We're all asking the question, will it work, or how will it work, or what can I do to make this work? But now we're at the point where the market has seen success. There's several different models that have worked, several different vendor systems and solutions that have worked, and so now I think we're at the point where we can say, what's the best, or how do I solve this problem in a different way, or how have other states solved this problem that I can adopt? And that just, I think, unfortunately wasn't the reality the first go out for the first open enrollment. But now that we've been through this a couple of times, now we're getting to the place where there's some true opportunities for sharing across the states.
You brought up a bad memory for me. In Connecticut, when I started in the summer of 2012, we did have those folks at UMass. Yep. To give you an example of this, the pressures we're under is we heard about NESIS, and it's a group of academics in UMass, and I remember they used to say, you have to come up every other week for like a day for a meeting to do this. And the fact of the matter is that just was not going to happen. So we started being disobedient real early in that regard, and it worked out for us. Subi talked about how Maryland and Connecticut, Maryland took our code, but he didn't talk about the fact that it's a two-way street. I'll jump in. We built the code, it works. Subi could probably tell you about all the things that still needs to be improved, but it's working for us in the fact that they have a better plan to do EDI. They do it better now than we did, and we're looking at trying to get that back from them and use that in our code. And what we're actually thinking of is, all right, as we move forward, how do we do what we're just heard about today? It's like, gee, why does it make sense to have something developed twice for the same code? And that's one of the challenges that we're faced with. But I wanted to hit Ethan, because you're from Idaho. You moved from the FFM to the state. as you made that move, did you get the benefit of any other states' knowledge as you put your SBM up and got it running?
Most directly, yes, from California. So Get Insured had a large space out in California. So when we were running into initial questions around 834s, we would try to leverage whatever experience GI had in that space. But given that we had 7 months, to your point, we didn't have time to collaborate. We're literally just now stopping, catching our breath, and trying to figure out what do we have that we can share with other states, and where can we learn and leverage from those other states.
What are some of the things that you? This isn't, since I'm up here, I can ask this question. What are you looking to share with other states? Because I'm thinking to myself, but we still have a lot of needs.
Operationally, right now, we're looking at a complex case management system. So how can carriers in a FSMA-compliant, MARSI-compliant manner share things with ourselves, with GI, and with our Department of Health and Welfare? So if we're going to stand up a complex case management system that's FSMA-compliant, that right there has an overhead that seems logical to leverage across states. So I've started some discussions with Code for America, see if that's something they'd be interested in theoretically, and I'm just now starting discussions with other states to see who might be interested in going in it together, so to speak.
Okay, thanks. Is there anybody here from Kentucky? Is Chris Clark here? One thing I wanted to point is one of the things that we've done in Connecticut with Kentucky is the two different code bases, same system integrator, but just as an aside, we've been working on process sharing. Some of our legal stuff that we've used to engage other states. For instance, when we work with Maryland, we work off of a memorandum of understanding, which is a lot easier to get people and materials back and forth than it is by starting a year-and-a-half procurement. Kentucky's using that with, I want to say, Washington in Oregon. Yeah, okay. So it's not just the technology that's being exchanged. And just make certain in Massachusetts, you described how the fact that you were kind of working out of a hole. When you were doing that, still, you guys were the first connector, the first really public exchange. We got the benefit of your perspective in our boss, the CEO. Are there any things that you look back now that, since you've had the most experience, that those of us that are now a couple years behind you, is there something that we could use or something that we should leverage?
Sure. So I think, and it's not necessarily in the technology space, but one place where Massachusetts has been, I think, very successful is with our plan procurement to determine the plans that we put on our shelf, the QHPs that we offer. Because of our history, we've been doing active procurements in our marketplace for years. Since 2006, we've been doing active procurements for plans. So we've been very successful at controlling the plans we offer, controlling those plans that we offer for subsidies versus not for subsidies. So in Massachusetts, the number of plans that are available on the silver tier for subsidies is actually limited to our total set of plans. And we use that as a means to offer an additional state subsidy on top of those products. And it's been very successful for us sort of to modify the market as a whole and to control overall cost growth in the market. So not necessarily a technology solution, though that's another area where we can talk, but I think where we've been the most successful and where states might be able to learn the most from us now is in the plan procurement area.
I talked about when we started that time and attention, and I think, Jason, you mentioned the same thing, kind of precluded collaboration and reuse at the time. Of course, time is always short, but we're seeing now that we don't have the time ourselves to learn the same thing over and over again. I'm thinking about other impediments to working together. And I had a couple ideas, or a couple of categories, regulation being one of them. Subi, or maybe Ethan, anything in the regulations, either in your own individual state or in the feds, that have kept you from collaborating or even trying to collaborate?
I can tell you that the regulation, in fact, from feds, they are promoting that. Fundamentally, we need to collaborate with the other states. Absolutely, there is no regulation stop us from collaboration so far.
Any challenges on the state level?
State level, from the procurement and legal wise, there may be some few challenges we are facing, but as long as, in fact, like this morning I was talking to my attorney. So her point is, there is nothing is going to be a blocker for doing this kind of collaboration. The only thing is, since it is a intergovernmental procurement process or any legal stuff coming into play, they need to have sufficient time to make sure all the legal statements, everything is in place, so that in future we will not get into some conflicts. So her point is very clear. She wrote an email saying like the advanced planning and strategic goal setting between two states could eliminate or mitigate any legal hurdles coming up, hurdles coming up later. So that is what her point is. So legal wise, I don't see any problem there.
Ethan, do you have something on that?
I was going to say that procurement is a challenge. So we're not a state agency, but we have a procurement process as if we were.
Yes.
So that coordinating what is right now a 2 to 3 month process with 3 to 4 other states kind of makes my head explode. Like, how does one even get that through the committees and the board in a timely manner to actually get the thing that we need at the end? So that, I don't have any answers yet, but that will be a challenge when we actually have to cross that.
Yeah. Prabhi, as a vendor, you must have a lot of experience with procurement and regulations. Do you have any words of wisdom for us as far as how to work the regulations and procurement to be better able to collaborate?
I don't know. I can't speak for the legal or the procurement per se, but in general, as far as the our situation goes, the product, we have the IP of the product, so we work with the contracts with the various states. You know, the advantage of in terms of reuse is we have every customer implementation goes, we learn something new, we bring them back into the product, and then the next customer has the advantage of, obviously getting those experience. That's how I would put it.
So if I could just
Jason?
jump in on procurements, ultimately procurement is what ended Massachusetts' collaboration with Rhode Island. We weren't able to figure out how to procure for systems integrators, and ultimately Massachusetts had already procured a systems integrator. Rhode Island procured a different systems integrator, and the collaboration kind of broke down at that point. I will say inside Massachusetts, we have a similar construct. Our exchange system is actually shared between Medicaid and the Health Connector. The way we got around procurement there was that neither of us procured. So Mass IT, who's our state information technology division, actually did the procurement. They own the system. They own the primary contract for our systems integrator. And then Mass Health, who's our Medicaid agency, and the Health Connector, who's our exchange agency, are the business owners of the system, but neither of us have direct control or ownership of the system. So really we founded, if you will, a third party that did the procurement for us. So there was one entity from a contract perspective that was representing multiple entities from a Commonwealth perspective. So just another way to get around the procurement rules. But absolutely, procurement is a big impediment and challenge to sharing.
Probably just as putting you on the spot here as a vendor, what would you think about states coming to you, a couple states coming to you to work together? Is there something that the vendors, would that be something you'd support, or would it be something that would be difficult for you?
No, I think, as Jason said, there is a legality, and the procurement has to be sorted out in terms of who the party you're signing the contract with. But I think from our standpoint, if you take the FFM shop that runs for all the states put together, that's sort of an example. The challenge from the product perspective is when you have 3 or 4 states coming together, what is the level of diversity among these states in terms of the policies or in terms of how much they want to influence in terms of the end user experience, etc. That's what drives the complexity in the product. But as far as we are concerned, we are a company, we host the solutions on the internet, and we can deliver, and there is a global economic efficiency in this process. As you say, 2-3 states can come together, we can solve the problem together at a faster pace, and we can weed out unwanted so-called uniqueness each state thinks that they have, and then there's a lot of efficiency that can be brought down, and price efficiency can be brought up, and I think it's good for the common good.
We're going to have to hold you to that one as we go forward. We talked about the regulation procurement, a lot of the focus on legal and the diversity between the states. What are there other processes, engagements? I'm thinking particularly around, we're talking about the people that we deal with directly, other state agencies, the feds. What about other organizations in the state that might be not focused on collaboration, or for that matter, to collaborate? For instance, in Connecticut, I had some challenges with some of our consumer advocates because their idea is that Connecticut was a separate state, and that it had to be. They were very, very vocal in the fact that Connecticut had to be Connecticut, 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 because nobody else was anywhere near close to Connecticut. And I guess that's true. We all like to think each state is different. But I thought that we lost the capability to work with a lot of advocates across the region. And it's something I want to start up again. What other groups are people thinking about working with, either within the government or outside? Either anybody in the sales and marketing aspect, collaboration between brokers across?
So I will say for consumer advocates and healthcare advocates in Massachusetts, we've had great partnerships. I think to the same point you were making, Peter, within the borders of Massachusetts, but healthcare advocates have the same message in every state, and I think we can encourage them to collaborate across state borders. And a door-knocking campaign in Massachusetts and a door-knocking campaign in Connecticut, I would imagine, look very, very similar. The goal is go online, sign up, get your eligibility determined, get a health plan. So we've had great collaboration with those types of entities, community outreach entities within Massachusetts. We've also, it's taken us many years to get there, but we've started to have really good collaboration with the broker community. Initially, I think we were seen as a threat, a disruption to a market that seemed to be working pretty well, but I think the brokers have learned to trust us more and more over the years, and they know, we're not here to eat their cake. We're here to help them find more people who need cake. So yeah, I think the brokers are a great place to collaborate. I think community outreach workers and community-based organizations are a great place to collaborate. Really, because as government, we can't get out to the whole community, but there are advocacy groups that can do that, and we all have the same goal at heart. So,
Ethan, I know that Idaho's got a very vocal broker community. Are you finding that your brokers, are they specifically in the state of Idaho, or are there things that you're learning from your brokers that would apply in the states around?
At this point, we've been mostly working with Idahoan agents, but something like over 60% of our enrollees go through agents or brokers. So it's an incredibly high percentage. So we view them as, obviously one of the more important stakeholders, and a lot of our development efforts this year will be focused on helping them to serve our community.
If you have 60%, that's high from my experience, at least meager, unique experience in Connecticut. What are you doing with those brokers that is making it so effective? Because I want some.
I think if I can speak on their behalf, I don't know that they would call it effective this first year. They did have some challenges. So while 80 or 85% went through well, that it was that 15 to 20% that caused them a lot of time. So in some cases hours. So we're working to see how do they actually use the system. So more direct user testing with them and taking those what we call production pain points into account for our development efforts this year.
Okay. Prabi, you've heard us talk a little bit about all the different things that we're thinking about. You as a vendor, is there something that we're missing that we should be thinking about from your perspective?
I think a lot of the discussions are centered on the technology part of getting it right. One of the challenges we see here is how to make, what kind of right policies that you can put in place to make, for instance, the shop business successful, right? That goes back to engaging with the brokers. And the way the public, and I see the difference because we operate both in the public and private marketplaces, both sides. And you see there are lots of things that are sometimes make it difficult for a broker to work in the public exchange, and the incentive structure in the shop isn't necessarily designed to attract the employers to use the shop marketplace. So I think there is for instance, there's a lot of authorization things that need to happen between employer and broker, and these employers will never come online because they get help from the broker directly, and the broker cannot initiate a business unless they get invited by a broker, by an employer. So there are many things that can be simplified, and from a sustainability standpoint, from a strategy standpoint, going beyond technology, how do they make this really work? Otherwise, they're not going to be able to compete with the private exchanges. When the employee size goes from 50 to 100, you got to have a competitive parity with the private exchanges. So I think those are the things we're interested to partner or work with the HICS agencies as customers, trying to see how to advance the game of innovation and add real business value. That's where I think that's where people would be headed as the next phase.
Look, we've got 5 more minutes. I'm gonna use steal what they did in the other room and have you guys finish up with a real quick blurb about what you want people to take away from reuse and collaboration. But before I turn them into that and give them a little bit chance to think, what about any questions from the audience? Questions about this stuff? Oh boy! All right, everybody. So, let me ask you guys. Everybody here is everybody here satisfied with their collaboration across different states and their reuse? Anybody have something that they want to share with us as far as something you've done that's been successful? Going once? Going twice? All right. I'll come back and loop again, but I guess I'll start and then I'll go down as far as the takeaway is. When I started, we didn't collaborate. We didn't try to reuse. We were constrained by time. Now we know that we're not as smart as we need to be going forward, so it's something that we're going to have to make the time to do going forward. Ethan?
We were really fortunate early on. Colorado reached out to us to help us stand up our NIST 853 MARZ controls. They let us leverage what they had, saved us probably 3 or 4 months. So my advice is to think outside the box and ask states. All we had to do was ask nicely and say please. And we got an email a couple hours later that literally made all the difference in terms of our ability to get our authority to connect and have a real strong security and control framework in place.
I think as a vendor, we are forced to apply the learnings and reuse and evolve the customer value on an ongoing basis. I would say as a customer, you should demand more innovation and value from the vendors, and that will up the game.
I cannot tell you how much advantage we gain from the Maryland because of this collaboration effort. We definitely gained a lot of time, and we know exactly that works, so there is no option for failure. So with this collaboration, we can gain time means cost. So definitely it is going to be a big advantage. Any state thinking of doing some collaboration effort, please go ahead and do it without even thinking. So that's my point. Thank you.
Yeah, I'm going to stay in the same time area. I think two specific examples. Colorado is a hCentive implementation as well, and when Massachusetts was looking at hCentive, we talked to Colorado. We talked particularly about wraparound services that they had built for case management. We didn't leverage their code, though they offered it to us, but we leveraged the concept, and that really jump-started how we did our case management implementation, or our case management operations that surround the hCentive system. And then also CMS, with the setting of the EDI standards. In Massachusetts, we had always customized the EDI files to match the carrier's requirements. That's just the legacy of how we had done it. But we were able to leverage or steal, if you will, the CMS standards and just offer them to our carriers as what we were required to do, and it dramatically simplified our EDI processing. So both of those things cost time to start. We had to have those conversations. We couldn't just jump into requirements definition or build. We had to go get something, learn it, understand it, and then build that. But end of the day, both of those things saved us enormous amounts of time. So when you say you don't have time to do collaboration, sort of check yourself. You do, and you'll actually save yourself time if you go find successful solutions that are already out in the marketplace rather than building on your own.
All right. So what we did is we talked a lot about different experiences, Maryland and Connecticut sharing code back and forth, the Idaho working with Colorado, the hCentive folks taking their knowledge and with a lot of different of their customers, and then Jason brought up some ideas about how we tried to do it in the start didn't quite work out, but now's the time. Opportunities, of course, with code and technology, but also people made the point as it's more than that. It's the planned procurement. It's all the other processes that we have to deal with. I know that Maryland, Connecticut are working are also working on the printing and mailing, collaborating in that regard too. And then as we summed up the knowledge of the group, I like Ethan's, ask and ye shall receive. That is so true. We're all in this together, and we're either going to hang together or going to hang separately. And spoken like a good vendor, demand innovation as you move forward. And then the points over from Subi and Jason is that, yes, it's an investment in time, but it pays back in time and in money. So thank you, gentlemen, and thank you. And we made the time.